I've had injuries to both shoulders, rotator cuff tear, impingement on the left, rotator cuff tear on the right. And what Zach has shown me is that I have an inherent weakness in the supporting muscles.
Normally I do pants pull standing up, okay? But I changed it to this one on the bench here. This allows you to slouch the shoulders down more and keep this pants pull position. And we can start, and what we're trying to target is, when we're doing this, if you come over top, he's got a real bad wing, okay? But elbow out. So I'm trying to slouch his shoulders forward, but what we're trying to target is this muscle here. Can you see that, babe? Right there. Okay? There's literally no muscle development whatsoever here. It should be popping out and elbow out. Notice how, even if we go back, if we start looking at the technique, notice how his shoulders are really rolled forward here, okay? If I let his shoulder roll back, going shoulder back, look at it. Now he starts getting more into the upper trap here. He's got to stay almost like you're trying to take your shoulder and roll it down to the floor, almost like you're trying to cover your chest. You get down a little lower. You can see how it covers his chest, and then the elbow's got to stay out and the hand in. And now he can, you feel that? Mm-hmm. Now he's locking right into there. And if you get over top, go ahead behind. Show him the mistake that you were making on this when you were doing it.
That was boy.
But you were coming, he was like this.
Also was coming in. Yep.
Okay, so, which isn't bad, you know, but as you get better, you want to have that. Hand in, elbow out. That's the feeling you want to have. If we look at this muscle here, okay, what we're trying to develop is that muscle right here. Okay, and that's what he lacks. There's literally nothing, no development, no support at all. And that's part of the problem. So this is another modification that I made for the second exercise here. Normally you'll see me on the bench. I do like a thumb down raise I used to have, and then I switch to the rear delt raise. I still have those in the system, but this is the foundation, okay? And these are called V-backs. We're moving on a V this way. The chest support just allows you to lock in better. There's just less moving parts. He's basically just going to be moving his arms out around 45 degrees out to the side. And he only comes up as far, look at his wing. Okay, so let's just come up. Let's get this wing taken care of right there. That's as high as he should come up, where he can connect and control the wing. Don't even yet. Yep, just hold it. Don't even worry about coming up and down. And if we look, go ahead down, babe. Look at how low he is in relation to the bench. Okay, so most people you see, they're going to put him on a pec deck. We'll start people out. We'll go like this. There's no connection. He's trying to connect to that part of your rear delt here. Okay, if we look, it's just a flat muscle here. There's no development. And we're also teaching him how to control his scapula. Look at how nice that is right now. If you get over top, look at how the wing is totally gone. When he started, go ahead. When he started, go ahead, let it wing out. Yeah, like it just, now it's actually starting to get controlled because he's starting to feel how to control the wing and scapula. Okay, let's do the other side. And that's why this exercise is so great, because you do it, you're killing two birds with one stone here. There, it's starting to wing. So let's go to the other side. Not bad. You got some control over the wing. That's good. There's a little bit, but not bad. And you feel here, yeah? Look at how there's no development here whatsoever. Good. Don't let this chain move. Just move from here. Yeah, you're just coming up too high. Just short. Yeah, right there. You feel that? Mm-hmm. If it comes up too high, less connected to the rear delt, starts getting into the rhomboids or the upper traps. We just want to connect here. Feels good? Mm-hmm. Okay, good. Let's do the other side. Hold on. Stay right there. Stay right there. Look at over top, babe. That's what we're dealing with here. Look at how nasty that is. Okay? Huge wing scalp. Go ahead. Let's see if he can get it back in position and control. Go ahead. Lift the arm. But you notice how he had control over that. Now he doesn't, because you're going to come out. Now flatten. Good. Don't come up so high. Just hold it. Hold it. When I start with some of those women, I try to have them roll forward a little bit here so they can really stay in control. And so that doesn't wing at all. If he rolls back too far, that's when, or tries to pull his shoulder blades back too much, that's when he's going to get a lot of winging. But the whole key with this system is not finding your range of motion where you connect to the muscle. If he comes all the way up here, you lose the connection, correct? Yeah. We want to build it low, and then eventually he can come up there, and it will start grabbing the muscle. We got to start where you can completely connect to the muscle where there's no compensations. You got to feel it right in the right spot. That's the key. Okay, good. The biggest problem is that people think like when they're doing pec deck like this, that they're actually working the right muscle, and they're not. You know, they're just working their upper traps. And so you got to really learn how to connect, and then you start improving the range of motions. If we take them over to pec deck, so you can see here. So this would be kind of the equivalent to pec deck. It's simply having the arms a lot lower, right? So, yep, hold that. Go, yep, right to there. You feel that? Now go where you disconnect. Go back too far.
I can feel it disconnected now.
Right there. And where do you feel? More up to the upper trap? Yeah. Good. So look at that. That's why I don't put people over here. Because he's just, yep, you done. That's it. His wings, it's too weak. It's physically impossible. Look at this. It's physically impossible for him to get into the rhomboids and the lower traps until he develops that veer delt exercise that we did first, until he develops that other exercise over here. And also, we have the pad cuff in our system. We also have the one specific for wing and scapula that we'll show you. But that's the issue, is that until he gets all these smaller muscles going, then that's when I start working on specifically rhomboid lower trap. But if I do that now, he's not going to feel, there's no way he can feel that. We have to start with the rear delts, the infraspinatus, teres minor, and get those things to work properly. Then we can go in and start doing this. Okay, go ahead. With this one is we're actually taking, everyone thinks that when you wing and scapula, you work on the serratus. You know, you do different serratus exercises. The problem is that he can't even access his serratus. It's physically impossible when someone has wing and scapula. What we need to do is we need to focus on humeral head depression this way. So depressing the humerus head down. And what that does is it creates a suction cup using the subscapula. Subscapula is your main depressor of your humerus. Okay? So major rotator cuff muscle. And that allows him to start pushing down this way and flattening. If he starts coming up, he can start coming up. Yes, yeah, right there, freeze. So that's a new level for you. Feel how you can fly? You want me to do this anymore? Yeah, that's good. So right there would be the perfect zone for him. You got to start where you can really flatten it. So he had to start way down here, and now he's starting to come up. That's a great improvement right there. Huge. Yeah. And now he's got control. Yeah? So this is how we start people off with wing and scapula.
And one, not just a muscle, and that part there, I can notice that I have chronic pain in my neck, and I wear a neck brace when I sleep. These exercises, this is now fading.
Right, yeah.
It's now starting to fade.
If you connect to the right muscle, every session you start learning to connect. As those build and grow, every week, every month, you start seeing the problems that you had go away. It's almost like that counter function. As soon as they start growing in strength, then your compensation starts shrinking in size. Yeah. All right, let's take a look at the other side. This is really good. You can start coming up. Yeah. Right there. I love that for you right there. Keep the elbow a little bit more. I'd say a little bit. It's a little, fold a little more forward. Starting to win out here. Not bad. Let yourself, yeah, there. Did you feel that? There. This side's a little more off.
And remember, I had a full repair on this shoulder, and an impingement repair on this one. So the internal landscape is a bit different.
Be pushing down this way, right? You're not trying to roll back this way. You're trying to push down. That's how he's going to get that subscap, because it's an internal rotator. So we have to press the humerus head down this way to get it to suction that. And could you feel this underneath working, kind of suction?
Absolutely.
And that's when everyone's like, oh, there's serratus. No, no. You actually want to feel behind the shoulder blade in the subscap. That's really the key. Okay, that's good. We just showed you 3 exercises. There's actually a 4th one. Okay, it's called the pad cuff. And again, you're trying to feel the right spot.
That's that one when on the ground.
That's the one that, yeah. And we have some of these exercises that we showed you for free. Okay, if you go down to the exercise demo in the details of the video, or you can look at our comments in the pinned comment section. And once you pass all these 4 tests, we have advancements that you move on to, another 4 exercises that you move on to that are harder, they're at more challenging angles, and they get deeper into these spots that we talked about in order to grow the muscle more and get rid of the compensations. And you could check that out too, our whole app for phase 1, phase 2, and then we have phase 3. So you could check that in the details of the video as well.
Or if you're not accustomed to apps like me, you can fly to Greenville and train with Zach in person. That's my style.
That's another option. Or you can do virtual sessions, which you will want.